Namaskaram. Greetings from India. Gratitude is the best attitude to have. And at the very outset, I would like to express my heartfelt gratitude to Mr. Neil Welsh, the President, Professor Ian Anderson, the immediate past President, and Council members for giving me this unique opportunity to participate in the first ever virtual ASGBI Congress. Everything begins with a story. My story began whilst I was working in the UK. My mother was diagnosed with breast cancer. Much as I had rewarding career opportunities in the UK, I relocated to India in 2007 to look after my mother and equally work alongside like-minded individuals and passionate colleagues and the government to make a meaningful difference to the delivery of breast health care in a country that I was born and raised. Over the past 14 years, I have been a living bridge between the two nations, replicating the best of British practices in an endeavor to improve breast health care in a country that I was born and raised. The aims of my presentation are to focus upon breast cancer care in resource-limited setting, and in this context, I shall be touching upon advocacy, screening, and the role of the Association of Breast Surgeons of India in standardizing breast health care. In India, breast cancer is a tsunami, with 162,000 new cases being diagnosed every year. Breast cancer is the most common cancer affecting women in the country. Unlike the West, where most breast cancers are diagnosed over the age of 50, in India, the vast proportion of breast cancers are diagnosed between the ages of 40 to 60, at least a decade earlier in this country. Due to lack of awareness and absence of an organized population-based screening program, coupled with enormous resource constraints, the vast proportion of women in this country are diagnosed with advanced breast cancer. 87,000 deaths per annum. Every 10 minutes, a woman succumbs to breast cancer in India. So the first component of my presentation is to touch upon breast cancer advocacy. Soon after relocating to India in 2007, I established the Usha Lakshmi Breast Cancer Foundation, which has my mother's name associated with it. The principal aims of the foundation are to create awareness, to reach out to the community and support breast cancer survivors and their families in the fight against breast cancer. Breast cancer is a taboo, a closet issue which is always hushed up, and that is one of the principal reasons why the vast majority present in the advanced stages. And I knew that there was an urgent need to disrupt this attitude. And so the foundation, to start off, printed 100,000 information booklets on every aspect of breast health, which has been explained in simple, easy to understand language in English and the regional language Telugu, and this was done in partnership with Breast Cancer Care, which was at that time the largest breast cancer charity in the United Kingdom. The booklets aim to counsel, guide and educate women in simple, easy to understand format so that they are better informed and better prepared about the diagnosis. And moving on, in 2017, inspired by Honorable Prime Minister of India's Digital India campaign, the foundation launched the world's first mobile app on breast health in 12 commonly spoken languages, 11 Indian languages and English, which explains about every aspect of breast health in simple, easy to understand format. This app is freely downloadable on the App Store and Google Store. This was launched by none other than one of India's icons and a very well-known film actor, Mr. Amitabh Bachchan, in March of 2017. It has been precisely 4 years, and soon after Mr. Bachchan tweeted about this, thousands upon thousands have downloaded this app and have benefited from it. The foundation also launched the Pink Ribbon campaign in 2007. The first high-profile celebrity breast cancer conqueror to visit Hyderabad was Marcia Barrett, the lead singer of the legendary Boney M. She is a breast cancer survivor, survived it twice. She came to Hyderabad at her own expense and performed and mesmerized about 10,000 Hyderabadis in the month of October in 2008. That was the very first time that the people in Hyderabad took notice of the foundation's initiatives. We had Mrs. Jeannie Mulford, the wife of the then United States ambassador, who is a breast cancer conqueror, not only visited Hyderabad to participate in a number of initiatives organized by the foundation, but she also became a patron of the foundation. Pamela Chopra, she is a breast cancer conqueror and the spouse of the legendary Bollywood filmmaker Yash Chopra. She is a patron of the foundation and has participated in a number of initiatives organized by the foundation, thus creating a lot of awareness. All these celebrity breast cancer conquerors created a lot of awareness through their celebrity status. The foundation also launched the Pink Ribbon Walk in 2007. The lady on the left is a patient of mine. After completing her neoadjuvant chemotherapy, she came on the first post-operative day to flag off the walk. The walk is held on the first Sunday of October, and the aims of the walk are to create awareness and salute breast cancer survivors and their families in the fight against breast cancer. This walk started off with just 50 people in 2007, and now every year we have scores of people, several thousands, who participate in this benchmark annual event, which is held not only in Hyderabad but in other parts of Telangana and Andhra Pradesh. As you can see here, this walk that was held in Vijayawada in the neighboring state of Andhra Pradesh attracted close to 10,000 participants. Film stars, sports stars, politicians. You name a prominent person and every prominent person in this region has flagged off the Pink Ribbon campaign and the Pink Ribbon programs conducted by the foundation thus far. The foundation also launched the Paint the City Pink campaign in 2007. The Buckingham Palace illuminated in pink in October, and similarly the White House. Mirrored upon this, the foundation has illuminated several monuments in Hyderabad in pink. Every year from the year 2009 onwards, every year in October, several monuments turn pink to demonstrate the importance of early detection. Last year, we had the Raj Bhavan, which is the residence of the Honorable Governor, which also turned pink to demonstrate the power of this campaign. So over a 14-year period, breast cancer advocacy has certainly made an impact in the urban areas of Telangana and Andhra Pradesh. The second component of my talk is on breast cancer screening. We are all aware that screening mammography saves lives through early detection. However, in a country like India, where more than 70% reside in rural India, is mammography a viable screening tool? Because what applies in urban India cannot be replicated in rural India. The real question is mammography a viable population-based screening tool in a country like India? We are all aware that evidence-based guidelines in high-resource countries cannot be replicated in low and middle-resource countries. Screening by way of mammography is not viable because of the huge costs, huge variation in mammography reporting, and most importantly, 87% of our population are under the age of 50 years, where screening mammography is not very beneficial. And therefore, in an endeavor to find an Indian solution to an Indian problem, the foundation, partnered with the governments of Telangana and Andhra Pradesh to train the healthcare workers to perform clinical breast examination as a screening tool. The advantages being it is simple, inexpensive, it helps to downsize the tumor size and is an excellent opportunity to empower people about early detection, hopefully translating to saving many lives. And the goals were, over a 4-year period, the foundation created the awareness about early detection and implemented a population-based screening program amongst the underprivileged women in rural areas of Telangana and Andhra Pradesh. This program was launched in 2012 with the Chief Secretary of the then United Andhra Pradesh along with the other officials. This is the Chief Minister of the state of Telangana in 2014 and also the Chief Minister of the neighboring state of Andhra Pradesh in 2014 endorsing this campaign. The healthcare workers were trained through audiovisual aids and booklets, and these workers were trained to create awareness and perform clinical breast examination amongst the underprivileged women between the ages of 35 to 65. If the screening assessment was normal, the woman would be requested to come back in 2 years for further screening round. If there was any abnormality, they were reported to the district health officials for further assessment. Any cancers that were detected were treated free of cost through the state government's Arogyasri scheme. These are some of the healthcare workers who were trained to perform clinical breast examination. This is another set of healthcare workers who were trained in batches. This is a typical community center in the village where the healthcare worker empowers the women and then conducts the clinical breast examination based screening program. So over a 4-year period between 2012 to 2016, over 200,000 underprivileged women between the ages of 35 to 65 spread across 4,000 villages underwent screening by way of clinical breast examination performed by 3,000 trained healthcare workers. 392 cancers were detected through this initiative, and all these women were treated free of cost through the state government's scheme. This program, which was conducted in Telangana and Andhra Pradesh, made a national impact. I was invited to be part of the technical advisory group and the steering committee formed by the Ministry of Health and Family Welfare, Government of India, and I am pleased to highlight the fact that the population-based screening program by way of clinical breast examination has been rolled out nationwide from the year 2017. The third component of my presentation is to focus upon standardizing breast cancer care. Mirrored upon the world's first breast surgical society, the American Society of Breast Surgeons, and indeed the Association of Breast Surgery in the United Kingdom, the Association of Breast Surgeons of India was formed in 2011. I was the principal driving force alongside like-minded colleagues who formed this association, and we have recently celebrated 10 positively eventful years. ABSI has within a very short span of time become the voice for breast surgery in the country. The association represents general surgeons, surgical oncologists, and plastic surgeons treating patients with breast disease. For the purposes of this presentation, I shall be touching upon only one aspect of ABSI, and that is the training module which was implemented across the country. This is a structured training program that aims to empower general surgeons practicing in rural parts of the country about every aspect of breast health. The aim was to ensure minimal, effective, uniform standard of care is delivered in the rural parts of the country. And I'm delighted to inform you that this program has been rolled out and several surgeons across smaller towns have benefited from this program. So in conclusion, ladies and gentlemen, the rising incidence and mortality and advanced stage at presentation in India is indeed a cause for great concern. The breast cancer advocacy, spearheaded by Usha Lakshmi Breast Cancer Foundation over the past decade, has certainly disrupted that taboo and created that much needed awareness about early detection. Screening significantly reduces the risk of advanced disease and positively reduces mortality. Whilst every effort must be made to encourage opportunistic screening mammography in urban areas of the country, the vast proportion of the population in India live in rural areas, 70%. So in resource-constrained settings such as this, clinical breast examination is an effective population-based screening tool. Over the past 10 years, the Association of Breast Surgeons of India has endeavored to standardize the delivery of breast health care in India and equally paved the path for developing breast surgery as a distinct subspecialty in this country. I would like to once again thank you for this distinct honor and the kind invitation.